I'm now joined by Aki Temiseva of Children Believe. Can you talk to me a little bit about, for those that don't know, what is this organization and how do you help kids across the world?
Sure, happy to be here. Children Believe is a global charity, a development aid organization working to benefit children all around the world. And we've been working for 60 years to break barriers to education so children can dream fearlessly, achieve their dreams, and have a voice.
And so now COVID-19 has had an impact on many charitable organizations. Can you speak specifically as to how this has impacted your operations?
Sure. So obviously, as anybody and all the people around the world have been impacted in this. So first of all, here in Canada, we all started working remotely. Thus, you'll see me in my own home now. And so we reacted very quickly. We also reached out to all the Children Believe offices around the world. There we have 6 offices and we work in 12 countries. And so we reached out and asked what the situation was there. Of course, we're monitoring the news. And within a week, in all those countries, the situation went to such that we really recommended and asked our staff to, for safety reasons, to start working remotely. Luckily, then, for us and the children and the communities we work in, no one has actually had COVID. So we work with, in addition to the offices we work with local partners. So, for example, in India, we have 5 grassroots organizations that are in each different states, and then they actually add up to 160 communities and community partners we work with. So we have kind of a network of people, and that allows us to be able to maintain our programs because we don't have to send in like we would be going to a community because we actually work within the communities. So there are different effects. So first and foremost, our care, this situation is for the health and safety of the children. So we try to help where we can. And the other things, we try to keep them learning. And again, that's at the very center of our organization to have that learning inside and outside of the classroom. So kind of we veered off to the other program. We said, okay, there's no inside the classrooms, but let's make sure there's outside the classroom. So we were kind of prepared for that. And then obviously we've had much of the discussion here in Canada also about the possible domestic violence and how the changing situation could be stressful for some families. So we try to also work with the partners in child protection. And finally, because of not the COVID, but actually the lockdown itself has created issues. And those economic issues then have, basically for many families, they could have lost all of their income. And for those families, then we've also had where we've been asking donations for emergency food packs and things that we can, all the way from just wheat and wheat and rice and pasta and kind of just very basic necessities. So that's kind of the overview, and each country is very different, obviously.
And so, how do you go about raising funds still? Do you have regular sponsorships, or are you doing an extra fundraising push so that people can assist with this extra cost that you might be coming into contact with your organization during this time?
Sure. So we're very blessed. So over our existence, we've helped over 1 million children, and actually, if you think of the reach, so each year our reach is, we reach 1 million people with our help, and that's only possible through our existing sponsors, 31,000 of them across Canada from West Coast to East Coast, and we are very grateful for them because, there's lots of hardship and people have lost their jobs here in Canada. So we haven't seen a full effect of that at all, and so we're super grateful. So I think people are really considering that, even though we have it hard here, that some other people could have it even worse. So that's the kind of the underlying structure that keeps us going and allows us to keep helping these children and other families across the world. But then we have also, launched extra appeals. I said, just the one I mentioned the last, for those emergency food packs. It's not something, you would do in normal circumstances. But again, you have to look at the situations. And also we do what's again new in this situation is different sanitation packages, whether it's hand sanitations or we also actually help local healthcare facilities. So in most remote villages, it would be a catastrophe if even the last spot of kind of safety would shut down. And often the government in these countries don't have the resources we have. So we kind of top up in a way, like, so when the government has to do their thing. And again, for this, we've asked, people to help in and kind of, if they are able to be, more generous of getting additional gifts for those kind of immediate needs for the health and safety of the children and the families.
Can you talk about, for those that might not know what countries and where the children are that you're supporting, what sort of conditions would they face on a regular basis, let alone during a pandemic?
Sure, yeah, no, and again, we work in a very wide array of countries and situations. So starting from the West, we work with Nicaragua and Paraguay here in the Americas. Working in Africa, we work both in West Africa and East Africa. So we work with Ghana and Burkina Faso and Ethiopia, and then all the way to India in Asia. So as people are following the news, the situation is very different. So Nicaragua was the last country to even acknowledge there is a pandemic, which then for an organization like us who likes to work with authorities together is quite challenging, because we saw a need before in a way that happened in Nicaragua. So the kind of things and hardships these children are having in general in these countries are that they don't have a voice, and of course often they're not in a position to kind of even decide on their own future. So if you go all the way from Nicaragua to India, for example, child marriage is still a huge problem. The numbers have come down, but we work with local agencies that's one of the key things for girls, if you can imagine, and their education. It's mandatory by law, so it's not about the law and the country not saying everybody should go to school, but if the more remote places you go to, the reality is like that, especially after the primary school, then you still have these harmful practices of the families, often also in poverty, and through marriage they get gifts from the groom's family, and so we try to educate that that is not only wrong, but it's also good for you to send your child to be educated, because an educated child can bring back all the wisdom to the village and to the family and all the goodness. And so we always work. We can't force the change, but we work with the parents directly through our counselors and convince them. We have lots of success stories where we've turned around the heads. We just ran a campaign with the local. Last year with local authorities there and local decision-making bodies in the village level, and to kind of educate on this matter, for example, on the child marriage. And we were able to actually convince hundreds of already set arranged marriages to stop and instead send the girls to school. So those are the kind of things that happen even pre-COVID. And now you can imagine with COVID, the uncertainty is even worse for these families. So what we do is we build awareness, and that's what we do very well. So we build awareness on COVID and how you prevent that COVID so that you stay healthy. Then we build awareness about how you can continue learning. And so, for example, again, staying in India, we work with counselors in each of the villages and remote teach them how they can then be an asset during this time of COVID, and then and work there within the limitations that are in that country. That's just a couple of examples of what we're doing.
That's really incredible and so widespread in the work that you're doing. If someone wants to get involved, how do they go about supporting? If they could become a regular monthly donor or do a one-time gift, can you talk about how people can do that? We really appreciate, again, saying, all the Kenyans that have done so much. But if you're able, you could go to our website, childrenbelieve.ca, or follow any of our Facebook pages, Children Believe
and become a sponsor. It's quite easy, and you can actually, if you have a heart for a specific region or country, you can decide that that's where I want to be, putting my dollars to help. Or then, if you feel like, okay, I really don't want to sponsor now, but I feel for the situation the children and families are in. So that would be something then you could find under childrenbelieve.ca/COVID, which is our COVID response fund, where we then have more of these immediate response mechanisms to help with food and kind of sanitation and all the PPE equipment for the healthcare facilities there, which they don't have. So the need is great. So I'm really appealing to all the Canadians who are able to continue sharing their heart as they have for the past 6 years at Children Believe.